to this Oncology Data Advisor interview, which today we're holding in honor of National Doctors Day, which is occurring this year on March 30th. And I'm joined by our guest today, Dr. Jafar Al-Mondhiry, who is a medical oncologist at Inova Cancer Institute. Dr. Al-Mondhiry, great to have you on the show again.
Thank you for having me. It's wonderful to be here.
Definitely. To start off, I'd like to introduce yourself and share a little bit about what you do.
Yeah, so as you mentioned, I'm a medical oncologist in the Division of Melanoma and Skin Cancers at Inova Cancer Institute in Northern Virginia. We're affiliated with the University of Virginia, where we teach medical students as well as residents and hematology oncology fellows, where I'm a core faculty member with the fellowship program. And I get very involved with the sort of humanistic development of our fellows. We have a really rigorous curriculum where we try and teach narrative medicine, communication skills training, as well as integrating our fellows in the support of patients in the survivorship care program and peer support groups. And so that's been just a wonderful part of being part of the Inova team for the last 3 years and being able to be really in the thick of seeing how our fellows develop as wonderful doctors and human beings.
Absolutely. I'm looking forward to chatting more today. So, as we mentioned, March 30th is National Doctors Day, which is a time to honor the exceptional commitment and care provided by America's physicians. So, we'll start off with this question. What does National Doctors Day mean to you?
Well, it's wonderful when we see it come up each year. I feel very honored to be a physician. I'll just say that first and foremost. Every day I'm seeing the effects of trust and appreciation for what we offer patients, particularly those with the highest needs, those with the advanced cancers. And so, in many ways, I feel that I am rewarded year round for the work that we do and those moments that we get with patients. But to have a day where we can really look at what it means to be in this position as sort of a frontline member of the community and interacting with people who are ill was a wonderful moment to appreciate what that relationship means and what it means to be a servant to others. And so, really, to be a doctor is to be a member of one's community and to be a loving member of that. And I think that care and support that we give to those we serve is just such a great part of what we get to do. And so National Doctors Day, I think, honors what we do for patients every day. And we get to be leaders of teams, and certainly we have many other days to recognize our advanced practice providers, nurses, medical assistants, respiratory therapists, many other members of the care team. And I think we all deserve just a quick moment to shine.
Absolutely, very much agreed. So, in addition to celebrating doctors on this day, it's also time to think about, mental health and wellness concerning doctors. So, what are some of the unique impacts on mental health that physicians may face, especially oncologists?
So this is a issue that's received a lot of attention within the last 5 to 10 years, and rightly so. I think we work in an environment that is inherently at risk of burnout and mental health issues. And by that I mean we exist in a climate where the expectation is perfection, and that is a rigorous and tormenting mentality to walk through the day with. When we are serving, particularly those patients where the stakes are the highest, those with critical chronic illness, those with advanced cancer, for instance, we are constantly feeling this mantle of responsibility for a very sick person. And we often don't feel in control of their outcomes as much as we try. And so while the stakes are high, the expectations are equally high on our end, and we know that what we do is a collaborative effort between all members of the oncology care team. So certainly our radiation doctors, surgeons, but also the nurses, MAs, and everybody else in the team. And I think that the physician holds this amazing sort of center role within this swirling vortex of healthcare, and trying to feel in control of all of these things, both the patient's trajectory with their illness as well as what the health system can bring for them in that experience, is just an incredible burden. And so when I think about burnout, I think about the environment in which we're constantly carrying this weight. And then we add to it the things that are unaddressed in medicine that are further worsened by the hidden curriculum that exists around us. So we're asked to deny that, the central irony is that we work in healthcare for sick bodies and persons, but we're meant to deny our own health and wellness within this. So when I'm ill, I'm expected to show up to work, good, bad, or indifferent. I don't get a sick day, or at least I don't feel entitled to one because of the people I serve and the responsibility I feel towards it. And that's a mentality that really shapes how we think about things. And just as an example, my own daughter was sick and in the hospital, and it was very difficult for me to consider pulling away from my responsibilities as an oncologist, because I think, who's going to care for these people? These are my patients. I know them. I care about them. We have a relationship that's unique, and I think my own experience is very representative of those of others, which is that taking myself out of that role, even for an urgent personal issue, a sick family member, a child, was difficult for me. Now, in the end, I did ask for help from my colleagues, and they really lovingly showed up for me. And I think that was a moment where I did feel that we exist as humans in support of one another, and we can patients can be remarkably accommodating to our humanity, and when we show up and say, I need something for myself, or I need to do this for myself. I While it feels unapproachable or insurmountable, this responsibility that we have towards others, and any we can't defy that or portray that in any way. Actually, my experience has been that patients show up for us in the ways that we show up for them. They see us, they care about us, and that has been a really wonderful thing to see. As not this hierarchy. Of course, there's a power differential between patients and doctors, but that there's a little bit of a leveling. When you share your humanity with them, they can show up in ways that are surprising and really loving.
It's wonderful to hear. It definitely goes both ways.
Yeah, and so I when I think about what else we can do in burnout, it's really thinking about the environment that we're in, those hidden values, the perfectionism, the denial of the ability to be sick or take time off, this incredible responsibility all the time that exists, not only within the walls of the clinic and hospital, but around it, beyond it, in our evening time, in our time with other parts of our lives, our family members and friends, and how it exists so through our whole lives, and there's not really a time off to consider it. And this pushing against these values that have been so ingrained in us over time has been takes an incredible effort, and it brings out more shame and difficulty and embarrassment to ask for what we need. And yet, I think if we can take the leap to do these things, to try these things, to ask something for ourselves, to take more time for the personal aspects of our lives, which may be neglected, personal health, showing up for friends and family members, doing something that we need for our own wellness. I think if we take that risk, if we push ourselves out there, we will be supported in ways that are often surprised about. I have been surprised in my own journey.
That's a really great piece of advice. So I'm sure there's a lot of unique challenges experienced by residents and fellows who are, starting out in the field. So what are some of these, challenges they face, and what advice and tools do you have for trainees to prioritize wellness as they start out in their careers?
So I think the global conversation around wellness and healthcare has also been one that's been focused on trainees, and so I'm happy to hear that mentioned frequently, and how we think about how, when we design programs for our fellows, when we think about work hours, it's a really now pervasive part of the discussion when we're working with trainees, and so it's been a wonderful cultural shift as well. that being said, I think that all of the values that we sort of mentioned before, the perfectionism, the slavish work hours, all of that's amplified in the training experience. And so, where I, as an attending, feel it's difficult to pull away from my work, I think that those in training feel even less entitled to have that space and time for themselves. And so, they're at real risk of this. Their identities are still actively being formed. They're working up against huge knowledge bases that are new to them. And so there's the feeling of vulnerability, of shame, of the incompetence that really deepens these experiences of shame that then become burnout and eventually just it can be a severe experience, emotional experience wherein they stop having those resources. I think one of the ways in which we can think about what is burnout. There have been many definitions. We talk about the Maslow definition of it, in which we talk about emotional exhaustion, depersonalization, and lack of personal accomplishment in one's work. But I think another interesting way to think about it is almost like a math equation. It's when the amount of work and demands in front of us exceed our ability to compensate or cope with that work. And once that imbalance happens, burnout is the natural effect of that, either to some degree or another. So how do we really balance that equation? The questions are systemic. I think first and foremost, we have to think about the workloads that we are putting on our fellows. We have to be sort of dynamic in how we think about the needs of individuals within that system. It may not be that one size fits all. And thinking about the other side of it, how do fellows, trainees, residents cope with the stresses? I think that's an individual question. And so when thinking about how to support individuals, it's not, again, everybody coming to the table with the same experience or tools or abilities. And so being attentive to what the individual in front of us needs, understanding that they're having a very different experience than other members of the training team or other members of the healthcare team, and that they're really struggling with the brand new set of responsibilities. They're responsible for this huge knowledge base that's completely new to them. All of that needs a special attention and focused support for that person and what they have and what they're bringing to it to balance out what they can do with the systemic workload asked of them and what they have to meet that in their own personal resources and resilience. And certainly within, I think as much as we can do this on an individual one-on-one level, I think we need to continue within each of our own institutions this conversation about what does it mean to develop and really form oneself as a professional in this very demanding field. And I feel lucky that we work in an environment at our institution where a lot of curricular time has been devoted to this question. And so whether it's using our abilities to have better communication with patients, we know that that can be an incredibly stressful thing when we have conflicts or difficult emotionally charged conversations with patients on a daily basis, as is the experience within hematology oncology. Really giving attention to how to do that better and help fellows and residents feel more competent in those situations, and a lot of debriefing on them after they happen so that they're having a proctored experience with these things. We think about what our values are going into it, and we should be having open conversations with it. And I think one of the tools that I use with our fellows is narrative medicine. The ability to sort of use stories in text, written podcast, or voice form to evoke the experience of training and the experience of being within medicine, and using that as a jump off point for individuals to reflect on their experiences in training and how they're digesting it. And so it needs space, time, and digestion, and support, role modeling. All of these things will come together to feel that they have a space to really work through the issues that are oftentimes generalized. So, the most powerful experiences that I've seen amongst trainees is when they sort of talk about a very difficult experience, and then the immediate response is, "Me too." There's somebody else in that room who's gone through something very similar. And obviously, those words have meant something different in the context of how we've come as a society to understand misogyny and the experience of women. But I think that this idea of coming together and having a shared understanding that we're not alone in the training experience and its challenges, but we're actually all of us having very similar experiences, and that those can be shared and mutually seen, acknowledged, and supported. So there's that mutual support element as well. So
Absolutely. Just knowing that someone else is going through, the same things, having the same challenges is very powerful. So,
absolutely, yes. And so I think that it's our obligation to give time to digest the experience of training while it's happening. I think this is even amplified in hematology oncology, where we're working with trainees who are experiencing more death and dying in their daily world than they ever have. And to deal with those who are so critically ill and approaching end of life also evokes not only very difficult questions of mortality and values around death, dying, and even questions of spirituality and afterlife, but our own place within it, the helplessness that we can feel in front of such devastating outcomes, our own sense of mortality as it reflects back to us, the untold grief that's accumulating through this experience as we connect, interact with patients, and then watch them go, watch them leave this earth is very difficult. And I think it's stressful for anybody, but the worst thing we can do is leave it unaddressed.
mhm.
So unaddressed grief, accumulated grief, there needs to be a space within the program within those in the faculty who can role model what it means to continue to do this work as an attending, and really open that for fellows to talk about with each other and with those charged with their training experience.
Absolutely. And that leads into my next question too about the systemic level. So how can hospital leadership help to combat the burnout that their physicians face?
Yeah, and these are difficult questions because they extend all the way out to what non-learners are experiencing as well. And I think it's a question that different systems are really still working out how they will respond to it. Cultivating community is the short answer to the question, but the longer one is much more difficult. And that how does one shape that? It has so many inputs and outputs. At least it's identifying teams as the unit of measurement, meaning that it's not about just individuals on it. How are we thinking about cohesive teams and how well they work together, and how well people from, I'll say, the most humble training experiences, those who are working with even down to the environmental staff, the maintenance staff, and phlebotomy, medical assistants. All of these are really critical members of the team. And how do we see this as a whole community? I think when we start to focus on, well, how do I help this one individual, we lose the sense of what it means to be thriving in one's work, which is to have a workplace where people are happy to meet each other, who feel supported, who are able to show up for one another when there are times of crisis or need. And to the extent that we're investing in that, giving space to it, it's as simple as an institution providing free lunch to the trainee. It seems simple. It sounds like a paltry investment, but I think it makes a big difference. And what I've seen is that as soon as you provide that, you also provide a space where communal eating exists. I know I'm sort of focusing on one very specific intervention, but I've just seen it work out so well in terms of having a one sort of design space, a small financial investment, and what can be a communal experience that's repeated on a daily basis. And it's also about having that workplace be uh, emotionally healthy for the faculty, staff, everybody within that institution, so that we role model for our trainees what it means to live and work well. We need to have, on the systemic level, people who are sharing their experiences with trainees and showing that they are universal and that they continue to evolve. We're all continuing to evolve as we move along in this process. So I can't say enough about having some curricular space for talking about how we're developing and debriefing on difficult experiences and having the skill sets to deal with these. So we need to see this as a priority. Thankfully, it is built in now into the ACGME requirements that there is a place for professional wellness within the curricular mandates. And so we need to sort of build that into how we train our fellows and how we give them the tools to move forward.
Definitely. That's great to hear that it's built into the ACGME requirements now. And like you said, like even little things like a free lunch can make a huge difference. So,
Absolutely.
as we wrap
Yeah.
up today, are there any parting messages regarding National Doctors Day, or any last piece of advice you'd like to share with the audience?
Yeah, I think that what we are experiencing as doctors can often feel lonely, stressful, and uniquely challenging. And when we walk alone with it, we're destined to really suffer with it. But we're really working in an environment where we're actually all sharing many of the same stresses, and we're not talking about them enough. And to the extent that we can kind of emerge and share what we're going through as individuals with our colleagues, with our trainees, it actually begets their own vulnerability, and then their experiences are shared with us. And uh, building a community where doctors are open in their struggles and supported in those is going to build a future where we're really much more aligned with our values and much more sort of emotionally healthy going into each day, knowing that we live in a space that has others in it that are experiencing the same thing and are able and willing to show up for one another.
Amazing. It's a great message to wrap up on. So thank you so much, Dr. Al-Mondhiry, for coming on today to share all these perspectives with us. We at Oncology Data Advisor are very appreciative and thankful of all the work that you and your fellow doctors do. So thank you again today for coming on to speak about this with us.
Absolutely. Thank you so much.